Your body
Early
knows
signs
before
of
you do.
pregnancy, what your body knows before you do. Your body starts
Your body knows
screaming
before
that
you
you're
do.
pregnant before any test can detect it. And I'm not talking about a missed period.
Your body
There's
knows
a
before
reason
you
women
do.
throughout history knew they were pregnant days, sometimes weeks,
Your
before
body
modern
knows before
medicine
you
could
do.
confirm it. What if I told you that within 6 to 12 days of
Your
conception,
body
your
knows
body
before you
launches
do.
a biochemical revolution so profound that it affects every single organ system, and most people completely miss the signs? I'm going to show you exactly what's happening inside your body during those critical first days and weeks, backed by peer-reviewed research and clinical evidence that will completely change how you understand early pregnancy. Before we dive in, let me be clear about something. Everything I'm sharing today comes from established medical literature, including Williams Obstetrics, the gold standard textbook used by OBGYN residents worldwide, peer-reviewed journals like The Lancet and the American Journal of Obstetrics and Gynecology, and clinical guidelines from the American College of Obstetricians and Gynecologists. This isn't social media speculation. This is what actually happens in your body, explained the way medical schools teach it, but in a way that actually makes sense. And here's what's fascinating. Some of these early signs have been documented for centuries, but we're only now understanding the molecular mechanisms behind them. The silent invasion, the story nobody tells you. Let's start with what happens the moment sperm meets egg. You've probably heard about conception, but here's the part nobody talks about. That fertilized egg, now called a blastocyst, is essentially a foreign invader to your body. Think about it. This cluster of cells contains 50% foreign DNA from your partner. Your immune system should attack it immediately, the same way it attacks a virus or bacteria. So why doesn't it? This is where the story gets incredible. The hormonal takeover. Between days 6 to 12 after conception, something extraordinary happens. That tiny blastocyst burrows into your uterine lining in a process called implantation. And the moment it does, it starts producing a hormone called human chorionic gonadotropin, or HCG. Now, HCG is often called the pregnancy hormone, but it's almost insulting to what it actually does. According to research published in the Journal of Clinical Endocrinology and Metabolism, HCG is one of the most powerful biological signals your body can produce. It essentially hijacks your entire endocrine system. Within 24 hours of implantation, HCG levels begin doubling every 48 to 72 hours. This exponential growth triggers a cascade of changes that affect your brain, your gut, your cardiovascular system, your kidneys, literally everything. And this is happening before you've even missed your period. The first real sign, implantation bleeding. Here's where most people don't realize what they're seeing. About 15 to 25% of women experience implantation bleeding, according to data from the American Pregnancy Association. This happens 6 to 12 days after conception, when that blastocyst burrows into your uterine wall. But here's the crucial part. This is not a light period. The blood is typically light pink or brown, not bright red. It lasts a few hours to a maximum of 2 days, not 5 to 7 days like a period. And the key distinction? There's no flow pattern. It doesn't start light, get heavy, then taper off. It's just spotting. Women have reported this for centuries, but we didn't understand the mechanism until the 1970s, when researchers finally documented the vascular changes during implantation using electron microscopy. Your body's biochemical storm, the fatigue nobody warns you about. Now, let's talk about something that hits almost immediately: profound, crushing fatigue. And I mean the kind where you could fall asleep standing up. This isn't in your head. Here's the science. Rising progesterone levels have a sedative effect on your central nervous system. Research published in Sleep Medicine Reviews shows that progesterone metabolites interact with GABA receptors in your brain, the same receptors that sedatives and anti-anxiety medications target. But there's more. Your body is also increasing blood volume by up to 50% over the next several months. That process starts immediately. Your cardiovascular system is working overtime, your heart rate increases by 10 to 15 beats per minute, and your blood pressure actually drops slightly in the first trimester. All of this requires massive energy. It's like running a marathon while your body builds an entirely new organ, the placenta, from scratch. Most people don't realize this fatigue can start as early as 1 week after conception, well before a missed period.
The breast changes you can't ignore. Within 1 to 2 weeks of conception, your breasts become a biochemical factory. Here's what's actually happening, and this is straight from textbooks on reproductive endocrinology. Rising estrogen levels cause your milk ducts to grow and branch. Progesterone stimulates the milk-producing glands called alveoli to develop, and prolactin, another hormone, starts preparing your breasts for eventual lactation. The result? Your breasts may feel tender or sore, especially on the sides, fuller or heavier, tingly or hypersensitive to touch, darker around the nipples as melanin increases. This isn't just discomfort. One study in the Journal of Women's Health found that 76% of women reported breast tenderness as their very first pregnancy symptom, often before they even suspected pregnancy. The nausea timeline everyone gets wrong. Here's a myth that needs to die. Morning sickness doesn't start until 6 weeks. Wrong. According to research in obstetrics and gynecology, some women report nausea as early as 2 to 3 weeks after conception. That's potentially before they've even missed their period. And here's why this matters. We're finally understanding the mechanism. It's not just HCG. A 2023 study in Nature identified a protein called GDF15, produced by the fetus, that crosses into maternal circulation and triggers nausea by affecting the brainstem's vomiting center. But here's the part nobody talks about. This nausea serves an evolutionary purpose. Research published in the Quarterly Review of Biology suggests it's a protective mechanism. During the critical phase of fetal organ development, nausea and food aversions steer you away from potentially harmful substances like alcohol, tobacco, and certain foods that could contain toxins. Your body isn't making you miserable, it's protecting your baby. The temperature that tells a story. Here's something that requires you to be paying attention. If you've been tracking your basal body temperature for fertility purposes, you'll notice something unusual. Normally, your temperature rises slightly after ovulation due to progesterone, then drops right before your period. But in early pregnancy, it stays elevated. According to data from fertility tracking studies, if your temperature remains elevated for 18 days or more after ovulation, there's a very high probability you're pregnant. This is pure physiology. Progesterone raises your core temperature by about 0.5 to 1 degree Fahrenheit, and in pregnancy, those levels keep climbing instead of dropping. The symptoms that sound bizarre but are real. Now for the signs that sound like old wives' tales but are actually documented in medical literature. Metallic taste in your mouth. This is called dysgeusia. Studies show that rising estrogen levels alter your taste receptors and increase saliva production, leading to that metallic or bitter taste. It affects up to 90% of women at some point. Increased sense of smell. Research in Chemical Senses Journal confirms that estrogen amplifies your olfactory sensitivity. You're not imagining it. You can literally smell things from across the room that never bothered you before. Excessive saliva, called ptyalism. This is less common but well documented. Some women produce so much saliva they need to spit constantly. The mechanism isn't fully understood, but it's linked to hormonal changes and often accompanies nausea. Mood swings. The emotional roller coaster isn't just about being hormonal. Research shows that the rapid increase in estrogen and progesterone affects neurotransmitter production in your brain, particularly serotonin and dopamine. You're experiencing actual neurochemical changes. The signs science is still figuring out. The gut-pregnancy connection. Here's something emerging in recent research that's absolutely fascinating: the gut-brain pregnancy axis. A 2022 study in Cell Reports found that pregnancy hormones dramatically alter your gut microbiome within days of conception. This might explain why some women experience bloating, constipation, or changes in digestion almost immediately. Progesterone slows down your digestive tract. It has to. It's making sure you extract every possible nutrient for your developing baby. But the side effect is that uncomfortable bloated feeling, even when you haven't missed your period yet. The urination frequency paradox. Here's something counterintuitive. You might need to pee more often before your uterus is even large enough to press on your bladder. Why? 2 reasons, according to research in the British Journal of Urology. First, HCG increases blood flow to your pelvic region, making your kidneys more efficient at filtering waste. You're producing more urine, period. Second, progesterone relaxes smooth muscle tissue throughout your body, including your bladder. You feel the urge to go with less urine in your bladder than before. This can start as early as 1 to 2 weeks after conception. The cervical mucus change nobody mentions. This one is not talked about enough, but it's clinically significant. According to fertility research, cervical mucus changes dramatically in early pregnancy. After conception, rising progesterone causes your cervical mucus to become thick, creamy, and white or pale yellow. This is actually your body creating a mucus plug to seal off your uterus and protect the pregnancy from infection. If you've been tracking your cycle, this change is noticeable and happens before a missed period.
Separating fact from fiction. The social media myths. Let's address some viral claims that have zero scientific backing. Myth: you can feel conception happen. Reality: no, you can't. The egg and sperm are microscopic. The meeting happens in your fallopian tube. There are no nerve endings there that would register this. Any sensation you feel is coincidental. Myth: pregnancy glow appears immediately. Reality: the pregnancy glow is caused by increased blood volume and oil production. This happens, but not for weeks. Anyone claiming they knew they were pregnant because of a glow within days is misremembering the timeline. Myth: you can tell the baby's sex by your symptoms. Reality: multiple studies, including a large one published in the BMJ, found no correlation between early pregnancy symptoms and fetal sex. This is pure folklore. What actually predicts early pregnancy? According to systematic reviews of early pregnancy symptoms, the most reliable early signs are: 1. Missed period. Obviously, but it's still the first. 2. Breast tenderness. 76% of women, often the first sign. 3. Fatigue. Appears very early in 60 to 70% of pregnancies. 4. Nausea. Can start as early as 2 to 3 weeks post-conception. 5. Increased urination. Often within 1 to 2 weeks of conception. But here's the critical point. These symptoms overlap significantly with premenstrual syndrome. The only way to know for certain is testing. When to test? Modern pregnancy tests detect HCG levels as low as 20 to 25 MIU per ml. Based on research from clinical chemistry, this means some sensitive tests can detect pregnancy 7 to 10 days after conception. For most accurate results, wait until the first day of your missed period. Testing too early leads to false negatives because HCG hasn't risen high enough yet. If you test negative but still have symptoms, wait 2 to 3 days and test again. HCG doubles every 48 to 72 hours in early pregnancy. The medical perspective. When early signs mean something's wrong. This is important. While early pregnancy symptoms are normal, some signs require immediate medical attention. Heavy bleeding with cramping. This could indicate miscarriage or ectopic pregnancy. According to ACOG guidelines, any bleeding heavier than spotting deserves evaluation. Severe one-sided abdominal pain. This is a red flag for ectopic pregnancy, where the embryo implants outside the uterus. This is a medical emergency. Severe nausea and vomiting. If you can't keep anything down, you might have hyperemesis gravidarum, which affects about 2% of pregnancies and requires treatment. Dizziness or fainting. While some lightheadedness is normal due to blood pressure changes, severe dizziness needs evaluation. The key message is trust your instincts. If something feels seriously wrong, it probably is. Call your healthcare provider. The variability factor. Here's something that doesn't get emphasized enough. Every pregnancy is different, even for the same woman. A 2019 study in human reproduction tracked women's symptoms across multiple pregnancies. The findings? Only 40% of women experienced similar symptoms in subsequent pregnancies. Your body's response can vary dramatically. This means no symptoms doesn't mean no pregnancy. Different symptoms doesn't mean something's wrong. What you experienced before might not repeat. The emotional component. The waiting period between suspecting pregnancy and confirming it is emotionally intense. Research in the Journal of Psychosomatic Obstetrics shows that symptom awareness is heightened when you're actively trying to conceive. You might be hyper-aware of every twinge and sensation. That's normal, but it also means you might attribute normal bodily variations to pregnancy. This is why testing rather than symptom spotting is the gold standard. Conclusion. So here's what we've learned. Your body is an incredible biochemical communication system. Within days of conception, it launches a coordinated response involving every organ system. These aren't random symptoms, they're purposeful changes designed to nurture and protect new life. But here's what I want you to take away. While these signs can indicate pregnancy, they're not diagnostic. The only way to know for certain is testing, followed by medical confirmation. And here's the question I want to leave you with. If pregnancy causes such profound changes to every system in your body from the very beginning, what other biological signals might we be missing in our daily lives? What else is our body trying to tell us that we haven't learned to listen to yet? That's a topic for another video. If you want to dive deeper into how pregnancy affects specific body systems week by week, backed by the same level of medical evidence, make sure you're subscribed because we're just getting started. Your body is smarter than you think. It's time we started paying attention.